also and a very warm good evening to all of you sitting out there. Well, आज हम बात कर रहे हैं भारत को आगे बढ़ाने का, सिर्फ इकोनॉमिकली ही नहीं बल्कि फाइनेंशियली भी. And we say even though India today is a developing country, for it to become a developed nation, it's very important कि कुछ ऐसे sectors जो हमेशा से हमें परेशान करते रहे हैं या मुद्दों या गंभीर मुद्दों या बातचीत के जरिए रहे हैं उनको देखा जाए. One of those sectors which is very important, of course, is the health sector. And somewhere in keeping this sector in mind, a very important collaboration has happened. This collaboration has happened between India and Africa, and this collaboration talks about the health sector and the research sector. Yes, the Indians and the Africans coming together to help the two continents grow together and also move forward by developing and prospering the health and research sectors. To talk more about this today, I have some very eminent personalities from both the continents today who will be talking about these two specific areas. It's a pleasure to introduce them to all of you. On my right hand, it would be Dr. Soumya Swaminathan, Secretary, Department of Health Research and DG, Indian Council of Medical Research. Namaskar, good evening.
Namaskar.
Pleasure to have you over here, ma'am.
Thank you very much.
और उनके साथ आगे बढ़ते हैं. On my left hand side, this would be Dr. Shahid Jamil, CEO, the Wellcome Trust DBT India Alliance. नमस्कार, good evening. और दोस्तों यहाँ मेरे लेफ्ट हैंड पे इस समय हैं डॉक्टर एवलिन नामुबिरू मुआरा, स्ट्रैटेजी एंड पॉलिसी मैनेजर, अफ्रीकन अकेडमी ऑफ साइंसेस. हाय, गुड इवनिंग.
Good evening.
Pleasure to have you two over here in the studios with us.
It's great to be here.
And finally, the most and the fourth personality or the person who would be there over here on the panel discussion with us today would be Professor Omu Ansala, Director, Kavi Institute of Clinical Research, University of Nairobi, Kenya. Hi, good evening.
Pleasure to be here.
And ladies and gentlemen, before we begin actually the discussion, let's also just introduce to our audience and another audience who's over here in the studios with us, who will be a part of our panel discussions और जिनके साथ हम आज बातचीत भी करने वाले हैं. It's our entire studio audience who's going to be a part of the show. We should now start back and get into the most important aspects of this collaboration that has happened. My first question directly would be to Dr. Soumya. We do know that India and Africa has collaborated, keeping in mind two very important sectors. One is health and the other is research. How do you see this collaboration being taken forward from here now?
Yes, thank you for that question. Actually, this is something that we've been working on only for the last 8 or 9 months. Of course, India and Africa, the history goes back a very long way. And our Prime Minister actually launched this very huge program, the India-Africa Forum Summit that was held in November 2015 to engage with all the 54 African countries in all different disciplines. Now, we thought that in the area of health, we should try to focus on research because our ultimate aim is to improve the health of our populations. But to get to that point, you have to go through lots of steps where you try to understand the disease burden and its epidemiology. You try to understand what are the risk factors that are causing those diseases in our country and what can be done to prevent, to treat and to control diseases. So to do that, we had the first India-Africa Health Science Summit in September last year. And the unique thing about this was that there were 4 ministries that came together from the Indian side. It was the Ministry of Health and Family Welfare leading it, and the ICMR, but also the Ministry of Science and Technology, Ministry of External Affairs, and Ministry of Commerce. And all the 4 ministers, union ministers, were there to launch this event. There were 26 African countries that were represented at that meeting with 7 ministers of health and very senior people who had come representing all the different health agencies and many of the research agencies, including the African Academy of Science and AISA that you'll hear about later from our colleagues. We realized that we have a lot of common health priorities, whether it's infectious diseases like TB, HIV, malaria, diarrhea, or whether it's now in the non-communicable diseases emerging, you know, we talk about stroke and cancer, and chronic diseases. And we realized again another common feature of both our continents is that we have a lot of young people. We have what's called the demographic dividend. But at the same time, we need to harness those young people into doing medical research, which is in the right direction, into science, into innovation, into finding solutions for our own problems. Often when we look at collaborations, it's always between a university in the developing country and an institution in the developed country. either Europe or North America. We want to change that paradigm, have what we call South-South collaboration.
Correct.
Because we have common priorities, we have resources, and we have strengths that we can match.
And untapped resources
And
also.
untapped
Yes,
resources.
yes.
So while global partnerships are important, we thought we have to strengthen the South-South partnerships. And so this whole, so the meeting that we're having over the last couple of days is really to develop areas in which we can take this further.
See, you've mentioned a lot of very important things in this entire thing that you just now told me. One thing that definitely comes to my mind, I would like to put this across to Professor Nzala. We're talking about the healthcare sector. Yes. Now, this sector is a huge sector, and we know that both the nations have problems, and I think problems on a huge scale, specifically in the health sector. What areas of health sector are you looking at covering? Because when we talk about health, it's a big issue of concern. It's not a small sector, and there are many diseases that are rampant. So many diseases that spread across the country, also at times in India, and they're coming across from the other side. How do you look at tackling these, and what are exactly the diseases that are priority right now?
Yeah, actually from the, the high-level meeting that took place last year, and now the meeting that is taking place the last 2 days, yesterday and today, we have agreed on our priority areas. And we know that if we look at the continent of Africa, and as well as India, we know that HIV is a problem. We know that TB is a problem. And in the last couple of years, we have seen a reemergence of cancers in Africa. So those are the three that we have actually put on the table to bring our scientists together to begin to ask ourselves, what are the gaps and what we need to do in the two nations, all right? And then the whole issue then is that we want to ensure that we can collaborate with Africa and India, but also collaborate within Africans ourselves, just to understand our burden, to understand the Indian burden, to exchange technologies, and the end really is to improve in terms of policy and practice. So it's HIV, it's TB, it's malaria, but there are other important aspects also, emerging and re-emerging infections. There's been outbreaks of Ebola, there have been outbreaks of Marburg, these are viral diseases, but also there are others like chikungunya and dengue, and vectors as well, transmitting vectors that are also very, very critical. So we have a clear list of things that we are interested in. We cannot do everything. We would have liked to do everything, but we cannot really do everything.
Right, yes.
So we have actually prioritized. But even within those, we shall ensure that we fill the gaps. We don't repeat what is already being done.
Correct.
Okay, we fill the gaps and ensure that we interact with each other. And really what is critical here is that it's not just an issue of African countries and India, but also India is helping us ensure that we also have South-to-South collaboration.
That's right.
That has not really worked very well because we have been individual countries collaborating with Europe or North America. But we have not seen very good collaboration within African countries. But this collaboration will ensure that Africa, India is there, but also Africa to Africa is actually there on those 5 or 6 priorities. Also not forgetting health systems. We have some very weak health systems in some countries in Africa, and it varies from one country to another. That's also one thing that we also want to put our hands together and see what do we learn from India, what do we learn from Africa, and what do we learn from other African countries to ensure that to ensure that we can enhance health systems so that our populations can really access good and good quality healthcare.
Okay, I'll just, I think, carry forward from there what Professor Nzala has said and come to Dr. Evelyn. He's talked about why we are focusing on healthcare today. One thing that comes to my mind, that why just healthcare when we talk about this collaboration, and why the research sector, why not the other sectors also that are or would be equally important? Why just healthcare? And what are the potential benefits that we see from these sectors that are coming out eventually for both the nations?
There are so many areas that one can focus on that are important. Emerging issues that are coming up, climate change, the disease burden is high. But we wanted to look at areas where we have common agendas or common interests. And important areas, health is coming out as a niche because there are new challenges that we are facing, But in addition to that, we also have existing challenges. We want to be able to move forward to address in the discussions we've had that India 30 years ago was still importing drugs and medicines, but now it's a net exporter. We want to move to the next stage, not only in Africa, but what can we learn together, south to south collaboration. So focusing on the area of health now is really important and imperative if we are to prevent these diseases from taking over the continent, but also developing. You cannot develop when you have a sick nation.
Very true.
Yes.
Very true. That's the basic thing that we should first look at kind of developing, because that's how you actually become mentally also strong enough to go ahead and work. Carrying from here, Dr. Jamil, if I were to ask you, when you talk about both the continents of Africa and India, if you were to look at the individual strengths and weaknesses, especially the strengths that would be looking at focusing on, what are those regions that you think can be developed and worked on so that both the countries or continents kind of just benefit out of this collaboration that has happened, specifically when we're talking about healthcare and research over here? So individual strengths and individual weaknesses that I think you would be focusing on.
So let me first pick up the thread that Evelyn was talking about, and you posed a question to her, why health?
Yes, why health? Yeah.
Why not? Three basic things: education, health, food. These are the basic needs.
That's right.
If you look at the populations of these two areas, Africa is a continent. Africa is not a country.
Correct.
54
Yes.
countries, one
Within
continent.
it, right? Yeah.
India is also a very large country, a subcontinent. What are the similarities? The similarities are that both of us have 50% of our population that's young, that's under 30 years of age. Now that's an opportunity, but that opportunity would be lost if you don't provide them health, food and education. So we are capable of organizing an effort on health, so we are doing it. There are other people, I think, who will be better equipped to do it on education and food, and they must do it. Our challenges are similar. The diseases that affect our people, it was mentioned earlier, HIV, TB, malaria. There are many other emerging infections, re-emerging infections. And see, disease is something that crosses borders. There was an Ebola outbreak in Africa, and that caused scare around the world. Viruses and bacteria do not respect borders. They don't require
Correct.
visas to go
Very
from
true.
one country to the other.
True.
So stopping an outbreak in Africa also makes sense for India, just as it makes sense for America or Britain. So that's one challenge, and we need to address that challenge. The other challenges are non-communicable diseases, diabetes, cardiovascular disease, with changing lifestyles in Africa as well as India. Nutrition continues to be a problem for us, for Africa. So these are really areas where we could cooperate and collaborate. And what we have been insisting at these meetings is that this collaboration is built on 4 very solid principles, or as we say, the pillars. The first pillar has to be mutual respect and
That's right.
ability to learn from each other.
That's
It
very
cannot be a
important.
one-way street,
Correct.
Africa to India or India to
Correct.
Africa. We
Yes.
have to learn from each other. The second is, whatever we do, we have to be world class. We do little, but we be world class in it. There's no point just doing things according to low standards. Finally, since we are focusing on research, it's very important that that research can attract the highest levels of international funding. A partnership between India and Africa would be extremely attractive for a lot of funding sources, and we cannot get those unless we are really world class.
Right.
And the final
Be
thing is
self-sufficient,
we
yes.
have to put together good management structures.
Very
So
important
we need
points,
to really
right.
focus on these things.
That's right. I think I'll just also move across to the audience over here, and I'm assuming, or rather I know part of you I already know, you're scientists and doctors yourself, right? I throw this open to anyone over here who's willing to answer, since you've been following this entire thing very closely yourself also. What do you think are the most important areas that we need to focus right now when we're talking about collaboration between India and Africa, looking specifically at health and research?
The greatest threats internationally are actually from diseases such as Ebola or Zika, global pandemics that have the ability to to work across borders and spread a scare and panic across the world. And how the Indian and African regions can collaborate with each other so as to stop them and devise strategies to be prepared for them before they break out.
So India has a distinct strength which it has displayed over a number of years, and that is its pharma sector. India is called the pharmacy of the world.
Right.
We sell about $25 billion worth of pharma products to Africa. We are actually the third largest pharma supplier to Africa. So that's a strength. We also have strength in making vaccines.
Yes.
So for example, 90% of the world's measles vaccine comes from India. So with these distinct strengths, let's say that there was an outbreak of Ebola in Africa. Once the strains have been identified, once vaccines have been made or research has been done, India has the capacity to produce these vaccines, these medicines at very affordable rates, which can then be sent back to Africa.
Right.
So these are the kinds of things that we would like to develop, we would like
I can
to
just
come up.
Yes,
add
please.
to that.
Yes, Dr. Soumya.
So there's now a global initiative called CEPI,
Okay.
and India is one of the founding members of that, along with Norway, the government of the UK, and the Wellcome Trust and the Gates Foundation. Essentially, it's CEPI stands for Coalition for Epidemic Preparedness Initiative, and it's exactly to do what you were saying, that at the time that Ebola broke out, there was scattered work going on in labs around the world which had tried to make a vaccine, tried to make a drug,
Yes, we do
but
remember
nobody had
this.
funded that to the extent where something was ready to be taken into the field. And by the time something was ready, the epidemic luckily had died down. So the idea is that the world needs to be prepared, because tomorrow you don't know where the next infection, the next
Correct.
epidemic
Yes.
is going to arise. It could very well be in India. We know that most of these new viruses which are emerging are occurring in either Southeast Asia or Africa, partly because of the close link between animals and humans, and also because there's still a lot of forests, and with deforestation, the ecology is changing.
Correct.
And you have vectors and insects coming into
Yes,
contact with
yes.
humans which were not there earlier. So to be prepared for that, the idea is that governments and companies around the world develop platforms which could be then quickly applied to any new virus. So like Dr. Jamil was saying, since we have good strengths in manufacturing capacity, we have good labs as well. One of the things that I think was discussed with the African and Indian researchers was, could we have some joint program on viruses?
To spread the knowledge. And
To
create
spread the
awareness
knowledge,
also,
to be
yes.
able to identify
Right.
viruses, to be able to do surveillance so that you can pick up when
That's
something
right,
is happening.
yes.
And the surveillance has to be done both in animals and in human beings. And also to develop diagnostics, to standardize some of the lab protocols. So these are things where our institutions, we have several in India that have expertise, can work with African institutions and develop these joint protocols,
Right.
so that in the case of an emergency,
We're
we're actually ready
Yes, we're
to
ready.
go in
Ready,
there, and
yes.
and whether it's a clinical trial of a new vaccine or a new therapy, there are now a lot of biologics which are being developed, specific antibodies which could be used. But preparation is key, and for that some investment is needed,
Right.
because you have to be prepared for something which may or may not occur in the future. Nobody can predict,
Correct.
but
That's
the
right.
investment has to be made now.
Correct. Okay, since you've talked about that, Dr. Soumya, brings to my mind, we've also touched upon the topic of research over here, the research sector that we're looking at. Let me just bring this into picture over here. How important do you think on that note, since we're talking about we've got to be ready, that's what Dr. Soumya also said, and I think everyone over here would agree, we've got to be prepared about any kind of an outbreak, any kind of a disease that may happen in the near future, may or may not. But your research has to be in place, your study has to be in place, and also you need to be prepared and ready. When we talk about all of this, how important do you think would be the role of information and communication technologies in this, to just spread the awareness? And also that she's mentioned over here, we need to look at some collaboration on that front. We need to bring together people so that spread the awareness in them also about the upcoming dangers that we may face or hazards that we may face when you're talking about health. So how important do you think would be the role of information technology, information communication technologies in this then?
This is certainly critical, and I think that for both Africa and India, we are lucky that there is a lot of technology boom that is going on now. We need to take advantage of that. Information should be passed on as quickly as possible, information that is easily understood. We need to communicate. One of the challenges we have on the continent and in many other parts of the world is the inability or the difficulty researchers face in communicating really important results from the studies they've carried out. So again, in this collaboration, one of the areas we are really stressing and we want to work on very hard is capacity building, not only in communication, but also in engaging different communities. The people need to understand what research is all about, what the results are all about, and what they can do to prevent not only the spread of the disease, but also to prevent their ignorance, to remove the ignorance about basic measures to help yourself once you are infected or anything like that happens. So major components of this collaboration will be really capacity building and engaging policy making or policymakers, so that once we are out of the lab, we are actually able to make a difference on the continent and on Indian country, so that we can move forward and say, yes, we made a difference after some time. So IT is really critical, and it's we cannot tap into this resource, this great resource that we have. It's a tool that we will need to engage with or to use it very well in our publishing whatever results we have. But it also helps us to collaborate. India is very far from Africa, you know, so the IT tools that are available will help us to continue talking, Skype, WhatsApp, whatever it is that we need to use to ensure that we continue talking. Right now we've had here 2 days, and a lot has been done in 2 days. But the conversations have to continue until things start moving.
Since you mentioned about the mentioned about the 2 days you've been here, and I would like to just move on to Professor Anzala and ask him. You've also been over here with Dr. Evelyn for 2 days. So far, how have these 2 days been for you? What exactly would you take back from here, from these 2 days of communication, conversations, and entire talks that have happened?
No, the 2 days have been quite interesting and also very exciting and also very exhausting, because we are now engaging scientist to scientist. We are actually sitting at the institute with the African scientists and the Indian scientists, and then beginning to ask ourselves, if we look at one area like HIV, what is India doing? What is Africa doing? What are the gaps? And what do we need to fill? So we are going through that kind of an exercise. And our hope is that within the next couple of weeks, we shall have very clearly structured a roadmap of exactly where we
how to work and where do you need to work and where do you need to start from, right?
Yeah. Yes. So it is a tedious process because it is an issue of a very extensive and very clear discussion. We don't want to repeat what is already being done, but we want to really ensure that we are filling those gaps. On each and every of these areas of priority that we have actually selected. And thereafter, we shall then put pen on paper to actually come up with concepts, come up with drafts.
Concrete plans.
Exactly, and eventually really have clearly written plans of what we want to do. And then eventually, my hope is that within the next 6 months, or even by early next year, we can begin to implement this.
Very nice.
Yeah, we really don't have too much, time to waste, because as we talk, you know, these diseases and issues I would say are also taking
Yes.
shape. To tell you the truth, although they are saying that Ebola is controlled, Ebola has not gone away. Okay, Marburg has not gone away. All these issues have not gone away, but they need us to be on top of things to ensure
They
that
need
we
to
are
be treated.
we are implementing, we are putting in best practices, we are ensuring policies are in place to ensure these communities are well informed of how these things are transmitted. Preventive measures are actually, you know, put in place to ensure that we are aware of what is happening in the environment. So this is exactly what we want to know, that within the next few months, these things are happening and we are actually moving forward.
Very right.
And I should add that within these 2 days, we've actually done a lot of work. We've really managed to concretize the ideas that we want to do. And it's exciting to be able to sit across the table and you find these same issues that scientists are excited about.
Yes, it's easier.
Yeah.
It just puts it in a better perspective because you know how and where you need to start working from when you have common ideologies and problems. I'll pick on from something that you said. You talked about capacity building being very important. I think I'll take that point and go to Dr. Soumya. What do you think would be the key capacities that both the regions, or should I say continents for that matter, would be individually focusing at that will help to strengthen this collaboration that we've just started off with? Individual capacity, because she's mentioned about capacity building, which is very important.
Yes, and in fact, and that's a priority for the ICMR as well. You know, we have a huge country, large number of medical professionals. I think every year we're producing 55 to 60,000 doctors. That number is going to keep going up, and about half of them also do a postgraduate degree. But if you ask doctors in our country about getting into a career of research, very, very few would actually opt for that. And I'm sure that's the same in Africa, where of course they have fewer medical schools and fewer doctors graduating every year, but the practice of medicine is their focus. And so what we are trying to do at the ICMR is also to stimulate medical students and postgraduates and young faculty to also do research on the side. You can be a clinician treating patients and also be doing high quality research, and we want to get more and more of such work, because we have to remember that any advance in care of patients comes from research. There's no other shortcut.
Right.
And so a country that does not do any kind of medical or health research is not going to be able to progress
Very rightly
or
said,
to be
yes.
able to develop, you know, new drugs, new vaccines, new
Yes.
treatments. So we need to spark that interest and get the brightest of our young physician graduates, you know, coming into research. So the ICMR has now a number of schemes to do that. So they have a common challenge. This is a common challenge, and so we thought, let's address this by trying to give them opportunities. You know, giving people, young people, an exciting opportunity to travel somewhere, to see something new, to interact with good scientists, and those good scientists could be in any country in the world. We're not going to limit and say you can only go here or there, but get that opportunity. You know, that's what's for many of us. We had that opportunity when we were young. And that sort of opened our eyes to a whole world of research, which we may not have been exposed to. Our strengths here are the burden of disease and our clinical expertise. I think African doctors, Indian doctors, when we get trained very well on the clinical aspects. The strengths in the West are an approach to research methodology. How do you ask a scientific question? How do you develop a research around that question, which is relevant for you? And so we have to learn, and so we thought we could learn jointly.
Yes.
You know, by having workshops, by having collaborations.
Bring the brains together.
Bring them
Wonderful,
together.
yes.
Take help wherever we need from
Yes.
other universities, institutions, but try to have a 5-year roadmap where we could have enough trained people so that we start doing that high quality science that Dr. Jamil was talking about, where people look at our countries and say there's top class medical research, you know, being undertaken.
Brought a very valid point. I think I'll move to my audience because you talked about research over here, right?
My name is Anant. I'm a medical doctor by training. The focus of my research is the intersection of public health, health policy with a focus on maternal and child health. And we're trying to look at health systems as well as part of that. And I think all of these areas are relevant in both India and Africa. And I think the other area which I hope the panel will speak to, and that's also a query to the panel, is given that the focus areas have been identified as HIV, TB, malaria, and some forms of cancer, what do you see as the importance of focusing on prevention technologies like vaccines? Given that there are strengths, as Dr. Jamil was speaking about, in India on the biotech side and on the vaccine manufacturing side, but also on the African side in terms of clinical research centers of excellence, how can we leverage those strengths in making sure that we are able to look at prevention as an important area of focus as well, especially on the research side?
Okay, I think we'll pass on that question also. I think Dr. Jamil could answer that if you want. Yes, please.
Yes, I mean prevention is extremely important, and as Soumya mentioned earlier about this initiative called CEPI, CEPI is really all about prevention, prevention of outbreaks. But I guess Anant, you're talking mainly about prevention in a local setting. So yes, that's critical as well. Prevention will only happen when there are good public health systems in place. IT is used
in the right way,
effectively, and that's a distinct strength that India has. The kind of mobile apps that are being built in India now for health are just phenomenal, and this is something that we can implement within the country as well as take to Africa. So yes, there is ample scope for that. Prevention is obviously very important. And we need to do prevention research as well.
That's right. You, Dr. Jamil, you also picked on a very important thing. When you talked about IT, you mentioned phones and technology. How important or how strong do you think a role the media would be playing in just strengthening the collaboration that has happened, specifically in promoting awareness, creating awareness for that matter, helping us and helping the African continent also build onto their strengths so that we can somewhere put a control on the health issues that both the continents are facing? How important a role will media be playing over here?
No, so it's obvious that media is very important. I mean, media is what takes our ideas to the public.
That's right.
Media is what takes what's happening on the ground to the public. And who funds research in our countries? It's the public, it's the taxpayer. So, you know, if the taxpayer doesn't know what we do in our labs, how will the taxpayer have confidence in supporting our work? So I think media is critical for that, and we really look forward to more and more media getting engaged with scientists, with doctors, with engineers in this country to take forward this message that you know, these people work very hard to do things for the country.
So do you think even the Indian industry coming together as a whole would help in strengthening the collaboration that has happened over here between India and Africa when we talk about these sectors?
Absolutely. And you know, one area of capacity building which I think is again critical in Africa, where India can contribute is going back to the pharma sector.
That's
you know, if you see India does about $25 billion worth of business annually in the pharma sector with Africa. India only invests about 20 to 30 million in Africa in the pharma sector. So there's ample scope for this. We need to be helping Africans make their essential medicines in Africa. What is the situation in Africa today? Africans make 20% of their needs, pharma needs in Africa. 80% are imported. This is the situation India was in the 1970s. We have moved on. We have done well. So we should use that, you know, we should channel that expertise, take it to the
needed,
to other parts.
yeah, exactly. Kind of just benefit from their resources, which are in, which are self-sufficient. In fact, I'll just take this forward. So, Dr. Soumya, what Dr. Jamil just now said, if you look at those things where he's talked about the media playing and the industry playing a very important role over here, do you think these initiatives are somewhere just going to help the participating nations further the collaborating board and also in the sustainability development goals that we're looking at ultimately towards achieving a particular target or a goal in the coming 5 years? Will it be beneficial for the participating nations also and kind of just contributing towards the strengthening of this collaboration also?
Yes, certainly. So in fact, when we had this initial discussions in September 2016, there was one strong pillar, and that was the pharma and regulatory side of things. So here, as Shahid was just talking about, we did bring in a lot of the leadership from our pharma and vaccine manufacturing industry. Several company representatives were there. We had also the representatives from the Drug Controller General's Office, the regulatory body, and from Pharmexil and other groups within the Commerce Ministry who actually help support this. So there was a lot of discussion on the side in how India could actually help set up manufacturing capacities, and there it has to be an industry. The industry has to take a leading role in this, with the support of African industry and government. On the regulatory side also, there's been discussion on how can we harmonize, because if every country has their own regulatory system, then for a drug or a new vaccine or a drug to get approved, the company has to go from country to country filing regulatory dossiers, and we lose a lot of time in that process.
Right.
So there's a globally thinking that some amount of regulatory harmonization, where if you have a strong regulatory system in country A, then the other countries around that may say that yes, we will align ourselves with this one. And so India is trying to have these kind of negotiations, saying that we have a very good regulatory system, and anything that we develop and approve has gone through very stringent quality testing. And so if that is accepted by some of the African countries, then it would make it easier also for more rapid approval.
And
one other thing I just wanted to mention here is that there's a lot of potential to develop new innovative products, whether it's diagnostic, because diagnosis today is very critical part of management of health diseases, and this is where we're often lacking, even in India. When
Yes,
if
you're
you go
right.
into periphery,
correct.
the diagnosis is being made only on the basis of a clinical examination by the doctor, and we need point of care, cost effective, quality assured diagnostics. So just like we have strips for blood sugar testing, we need similar things for many other diseases that we, and there's a huge amount of innovation that's going on in this field, developing platforms that could be used in primary health settings without electricity and without any complex lab equipments. This is an area where the Indian entrepreneurs are really doing amazing work, and a lot of work going on in Africa as well. So as was mentioned, common priorities are there. So if we could develop a cost-effective tool for early diagnosis of esophageal cancer, for example, or cervical cancer, or for high blood pressure that a health worker can use on the periphery, that would be amazing advance. So this is an area where we can contribute, and we can actually do things which the West may not necessarily be doing, because they are not necessarily looking for
Right, because
low
they're
cost.
already developed nations. We're talking
Yeah,
about developing
and so
nations.
they're
over
looking
here,
at really the high-end equipments
Correct.
which they already
Yes.
manufacture
Yes,
and
yes,
develop.
that's true.
We're
That's
looking
right.
at very simple technologies.
Yes.
So I think a lot of our focus should be on that end, on not only helping young people to develop, but then we need to test and validate those, and that requires a system and a proper approach.
I think that's one of the reasons why we've also looked at a South-South collaboration over here, because the parameters and the kind of ideologies and the kind of concerns that we're sharing are very similar.
Yes.
Else we could have looked at some probably a West collaboration also, but over here we're looking at developing nations who share similar concerns that we probably would look at dealing with. If I were to just pass this on, and I would want Professor Anzala to add on to this, how do you look in the next coming 5 years, should I say for that matter, at dealing with these concerns? Because if we are just to look at the way the Indians and the Africans' concerns and place them on the table, they're almost the same. What are the exact layout plans that you would be having immediately, step by step, broader horizons that you're looking at going and achieving step by step in the coming 5 years plan? The broader horizon.
Okay, the broader horizons, for example, is that if we took a condition like cancer, we want to quickly look at the burden of cancer in Africa, very, very quickly, map it out, get to know what cancers are occurring where, then very quickly get to know, are they related to infectious diseases or are they not? And then with that, now we are trying to put together knowledge to tell us, how do we screen for them? How do we then prevent them? Because you see, part of what is going now is that we are seeing cancer downstream. But what we want to ask ourselves, even if we develop technologies to manage cancer very well, we would like to prevent as many cancers as possible.
Right.
because that's where the cost
Exactly.
savings
Yes.
are.
Yes.
So those are the kind of things we are looking at. Two, he asked a question about prevention. All right? We are also asking ourselves, in terms of emerging and re-emerging infections, what we want to do very, very quickly is to understand those pathogens and begin to ask ourselves, can we develop a very quick, easy-take, low-costing point of care diagnosis, so that at the village level, at the clinic level, at the dispensary level, we can quickly be able to make a diagnosis
That's right.
of Ebola.
And
If
that
that
would
could
be
have happened in West Africa, things would have been different.
Different.
Because it took too long.
Yes.
Yeah, those are the kind of things we are looking at. And at the same time, if that happens, then what do we do? All right? If quickly a diagnosis of such a thing is made, what systems have we put in place to ensure that we quickly move in very, very fast? If there are vaccines, all right, if there are drugs, then the system moves in, and also the preventive aspects are already there. If it's a vector-borne and we know there are mosquitoes, what do we do within that area, and how do we communicate to other communities to ensure that the surveillance programs are
That's like
actually
reaching
working?
at the grassroots level to the
Exactly.
most basic needs of the
Exactly.
basic man
So
out
for
there, right?
us, it's very
Smallest,
clear. Yeah,
right.
it's very, very clear to us on all these fronts what we actually want to be able to do in the immediate and in the few, and actually in the future. Because for us, for now, we really don't have, the luxury to do research for the sake of it. The research we want to do is what will improve practice and what will improve policy immediately. No, later on when we are richer, okay, and we have reached another level of wealth, then we
And
can,
development, right.
development,
Yes.
isn't it? Then we can put all these other fancy, research in place.
Right.
But for now, there are certain things that we must do.
Correct.
And one of them is just what I've alluded to in terms of infections, in terms of TB. For example, TB. We thought TB was gone away, actually gone. When I was leaving medical school in Kenya, for example, they were closing, TB, TB wards. But to only wake up 4 or 5 years later, TB has re-emerged.
Right.
And it is even more resistant.
Yes, true. It's
Exactly.
like been a never-ending
Yeah,
disease out
exactly.
there.
So what
Yes.
we also want to put in place is that we are closely following those strains and understanding, are they beginning to change? Are they showing any signs of becoming resistant? And what do we put in place? And that's where now pharma in India comes in very, very closely. Can we learn and quickly then modify the drugs we have to ensure that we consistently have effective drugs as we talk about prevention?
Right.
So our map is very clear as to what we really want
Look
to
at
push
working
in.
on and doing,
Exactly.
right? Let me just move across to, I think, probably the last question I'll be asking Dr. Soumya, because if we look at this collaboration that has happened, from the Indian side, it's been an inter-ministerial effort, while from the African side, it's a governmental effort, intergovernmental effort. Does this somehow in any way, can we just pick on from these lessons of the collaboration that has happened towards furthering trade and partnerships between the two continents, apart from the fact that we're already promoting research in healthcare sector? Can we also look at somewhere promoting and furthering and strengthening up the trade and partnership aspects also of these two continents together and opening up those avenues also?
Sure. I mean, I think as I mentioned earlier, that is definitely a part of the vision of this partnership. And that's why we have the Ministry of Commerce and Industry on board as well, and they're leading that aspect of getting our vaccine and pharma manufacturers and also people who run hospitals. We have several large chains of hospitals, so there's already quite a lot going on in that area where African doctors, lab technicians, anesthesia assistants and so on, they come to our hospitals for training. So that's one aspect of the clinical training going on, and then also going to Africa and setting up facilities there. So those are also going on in parallel, but because we at the ICMR, our main focus is really on medical research and on health research. We are the lead for this aspect, and so we have identified different ministries and different agencies that will be leading the different aspects. So there's the Department of Health is also looking at, one is at supplying aid in terms of donating ambulances and drugs and so on. So that's happening. and also at facilitating this type of exchange for more clinical types of training. And the Ministry of Commerce has the program for encouraging trade and industry, and the Department of Science and Technology actually has a large number of fellowship schemes which they offer also for Africans to come to India for training.
So these are some of the aspects that we're looking at and probably also working on, should I say, in
Working on,
collaboration with,
and
right?
yes, exactly.
Yes. Okay, let me just go to Dr. Jamil and ask him. What Dr. Soumya said were the different aspects and the different collaborations and the industries and also that we're working with and looking at. If I were to just ask you the top 3 concerns that you would look at probably dealing and sorting with right now through this collaboration in the healthcare and the research center, what would those be that you think are topmost priority right now that need to be dealt with immediately?
Topmost priorities, I would say, would be identify common strengths and focus on them. There is a tendency to grow horizontally, not vertically.
Yes.
We need to
you're
do
right.
that. And this is a problem as much as on our side as it is on
The other side
the
also.
African side. So both of us need to focus, start with small goals and then build up on them. You can't put together a 30-year plan when you have a collaboration for which money is there only for 5 years. So be realistic. I think that's one. The second is for our regulatory systems, our funding systems to be nimble and to move quickly. If it takes a year for a project to get cleared and funded, science is not static.
Yes.
Knowledge is on the
right.
move.
Yes, completely.
So
that's right.
it's not, you have to have the right time to capture that
Correct.
knowledge.
Yes.
So I think we need to be nimble. We need to be flexible.
And more agile.
So that's another thing I would say. I would say those are those would be
Top
my
two most.
top things.
Let me also ask the same thing to Dr. Evelyn, because you come from the African side. If I were to say, keeping your continent in mind, what would you say would be the top 3 most priorities that you need to look at right now, and you feel the need of the hour is that through this collaboration, we deal with them first right now? What would you be looking at from that side?
Well, like they said, Africa, we have 54 countries. So I think top priority is to see how we can work together, these many countries with different agendas and different priorities. How do we look at the issues and select the topmost priorities? And I think also a priority is to work out the coordination, governance issues.
Correct.
Again, so many different countries, so many scientists, different needs and really agendas, because diseases that are important in West Africa might not be as important in East Africa.
Right.
How do we prioritize among those so many issues that we need to deal with?
And put them together under
And
one
put them
roof.
together, and yes,
Right.
and then work together as one
Yes.
team. But I also think a priority is to make sure that this collaboration actually benefits our Indian
countries,
colleagues
right.
as much as it's benefiting
That's
us.
right.
I believe that both for Africa and for India, there is comparative advantage. And so we should be able, on certain issues, so we should be able to tap into that so that each part of the team actually benefits very well
That's very
from this
important.
collaboration. I also think that moving quickly, there are governments and political issues that need to be sorted out, and again those will need to be handled very quickly, efficiently, and to move along so that we can, within the end of the year, we can say we have begun and we have achieved a lot.
That's right.
I believe that there are already structures that are in place. For example, Dr. Soumya mentioned I come from the African Academy of Sciences and also from AISA, which is excellence in science in Africa. So our goal is really to promote excellence. We've already
that's
set out
important, yes.
exactly. We have an excellent platform that is well equipped with world-class resources that can be used as a start or
Right.
for any other institutions that are in place. So we need to look around and see which institutions should we start with that are already doing work so that we can move very quickly, both from Africa and India?
That's right. Okay. I think I'll just go ahead to the audience very quickly because we're running low on time also. Any piece of suggestion or advice you wish to give to our eminent speakers today, because they are the people who will be taking across from whatever inputs you would get, because this will only enhance the collaboration that is happening. So if you have anything to say to them today, I think right now is the right time that you could just express a thing that you feel needs to be dealt with right now, apart from whatever we've talked about on this platform. Yes, please.
Yeah, so there are two areas that you're looking at, health and research. So what my question is that how do you translate research into actual health activities or actual health implementation? And what are the key problems that lie there, and how would you want to tackle them through the efforts that you're making right now?
You cannot keep practicing medicine the way medicine was practiced long time ago. And the only way again to improve medicine is to consistently do research, because then research informs good practice and research informs policy. So as we have said, we are clearly beginning with an end in mind. If we talk about emerging and re-emerging infection, it is very, very clear. We have learned from what happened in West Africa with Ebola. So we are saying, what research do we need to do now to ensure that we put preventive measures, screening
in the
measures
right
in
direction,
place
that's needed,
to ensure that such a thing never
happens.
again.
Yeah.
To look at your question, because you are talking about you work with children and child mortality, the issue again will be, if we are interested in such an area, will be that what is really causing that mortality.
Correct.
Then can we go back and ensure that we begin to look at mothers during antenatal care?
Retrace the steps back,
Yes.
right?
Is it nutrition? Is it this? So that we go back and retrain. All right?
That's right, yeah.
If it's good practice, retrain and put certain measures in place to ensure that that child mortality does what? Actually goes down. And it is research. It is creation of new knowledge. And that new knowledge then informs practice as well as informing what? Informing policy. But that practice also means training and retraining. So that's exactly the interest here, that you cannot talk of health without talking about research.
Correct.
You cannot talk of health without talking of creating new knowledge. So that's exactly what, and then asking ourselves, is what we are doing the best, or can we do it even better?
Right.
So it is research, but built within that is also what we refer to as implementation research. Just relooking at what we are doing and asking ourselves, could we do it even better? And if we know we can do it better, then we retrain. All right? And that's why we keep talking of short courses, long courses, and all these aspects of it. So that's exactly what I would see that this collaboration will actually endeavor to do.
Yeah. I guess on that note, it's also time for us now. We've had a very important, fruitful discussion over here today on the collaboration that's happened between the Indian and African continents, keeping in mind the health and research sectors, two very important areas that both the continents are looking at improvising and getting somewhere, just taking off the strengths from the other continent and developing on their own weaknesses and doing away with those concerns which have somewhere predominantly been bothering both the continents for years, should I say, be saying right now, decades for that matter. It's time now also for me to thank all our eminent speakers over here who joined us today. First of all, Dr. Soumya Swaminathan, thank you so very much. It's been a pleasure, ma'am. Thank you. And then we had over here on my right hand, we had Professor Omu Anzala. Thank you very much, sir. It's been a pleasure having you in the studios with us.
Exactly.
Thank you.
Thank you.
And on my left hand, it would be Dr. Shahid Jamil. Thank you so much. Thank you very much, Dr. Jamil. And finally, we had Dr. Evelyn Namabiru Muara. Thank you very much.
Thanks for having us.
Thank you. And I think it's time for me also to just thank our audience, a lovely audience who's been not just inquisitive but also a very patient one, giving us those necessary inputs when we needed them from today, from all of them. Thank you so much. You've been a lovely audience. Thank you. It's time now for me to bid adieu and say to you goodbye. I shall be seeing you next time. Hope you have a wonderful day ahead. Goodbye.